One of the things that the council's got to do is look at all its services and try and make them cheaper, cost less too. I'm really sorry, I'm going to be loud because I want everybody to hear, right? Today what the Thurrock Coalition are doing is helping the council launch the adult social care consultation. Thurrock Council wants to know what you think about the ideas they've had to save money. I took this presentation to Thurrock Disability Network last night and talked to a whole range of carers and disabled people, and their message basically is just say no. Why might that be? Well, the fact is that just because the government's got less money to spend, and just because they've asked councils to spend less money, doesn't mean to say that the cuts should all fall on adult social care. It actually applies right across the council, not just to adult social care. But you've got an opportunity to say what you think about the proposals that will affect the services you get now and the services you get in the future and the services that people you know about or care for get in the future. So it's really, really important that you take part in this consultation and that you say what you think. So please tell them what you think. They want to provide services to support people to be as safe and as well as possible, don't we all? And they're saying that they haven't got enough money to do this for everybody. They must give it to the people most in need. Well, we don't disagree with that either, do we? What we do disagree with is whether or not cutting services in adult social care is the most effective and efficient way of doing things. The council's got 5 ideas and they're written down in a form that you can get copies of in a bit. They want us to look at and change the rules about how the money the council has is spent on social care services. The effect of that is that they will make it harder for people to get help. They want to think about charging people more for the services they get. The network suggests the effect of that will be that they'll make people pay if they do get help. They want to look at services that help the carers centre provides and change the way this is done. 3 of the 4 proposals say they want to close the carers centre. They want to review respite services for disabled adults, that is, disabled adults with learning disability and physical impairment under 65, which are run from Hathaway Road short break services and Breakaway in Averley. And in effect, that will reduce help for unpaid carers. I've got a rabble in the audience. They also want to look at the disability provider services and how they're run. What that means is they're expecting someone else to do better than they do for less money. So those are the 5 proposals that have been put forward. And just to quickly say that the ways in which they've explained each of the proposals very carefully in the information that's on the internet. Can I just check how many people in this room have the internet in Thurrock? Quite a few, that's good. And how many of you actually look on the internet to see what the council's saying about the services it's changing? 3, 4, 5, 6, 7, hopefully. Right, so not quite as many. So not all of you have it and not all of you are using it actively to join in this consultation. So what this is about today is the coalition giving you an opportunity to find out what's going on so that when you go to the public consultation meetings that the council's going to have, you have a bit of a chance of being able to make your voices heard because you will understand what you need to shout up about, right? So everybody's got to have an assessment of need. This is what has to happen before anybody gets any service. And if they're proposing to change any service, you have to have a reassessment of your need. And there are 4 levels of need. There's very low need, where we just give information.